Now over to you, Julia.
Thank you. So I'm going to talk about first what hopefully we're going to cover in this workshop today. So we're going to talk about understanding PCOS and its impact on fertility. And then I'm going to talk about how to tailor PCOS fertility, nutrition and lifestyle changes with a busy work schedule. And then we're going to look at some practical strategies for healthy eating and stress management work. So my aim is to make this session really practical for you. So you go away hopefully with some tips that you can kind of start using straight away. So before we get started, a little bit about me, if you've not heard of me before. So my name is Julia Young. I'm a registered nutritional therapist and I studied at the Institute of Nutrition in London. And then I went on to do further study to become a certified fertility specialist. I'm a member of the British Association of Nutrition and Lifestyle Medicine and the Complementary Natural Healthcare Council, so I follow their code of ethics. And I myself have PCOS. I was diagnosed with PCOS many years ago. And at the time, I'd taken the contraceptive pill for many years, came off the pill because we wanted to start a family and my periods didn't return. And I went to the doctors, had various tests done, and was told everything was fine. But then eventually I was told I had actually borderline PCOS and I wasn't ovulating. And for that reason, we couldn't, at the time, couldn't get pregnant naturally. So we had to go down the road of fertility treatment, and we did various rounds of IUI treatment, IVF, and unfortunately had a miscarriage along the way as well. But it did eventually work for us, and I'm now the mum of two boys, one almost teenager and one teenager. So this all happened quite a long time ago. But it was only after having my family that I thought, and I didn't have periods at all during this time. That's why I wasn't ovulating. I didn't have periods, and this was going on for 7 years. And I realised that this was probably not a healthy thing not to be having periods. So I started doing some research into it. And even though my doctors were not concerned, I was. So I did some research and I changed my diet and my lifestyle. I didn't have the healthiest diet. I was over exercising. There was a lot of stress going on. And to my amazement, my periods returned. And that's when I kind of realized the power of nutrition and supplements and changing lifestyle. So that's when I went to go on and study the subject. And so now I help women and couples and support them on their fertility journey to help them conceive. And I have a very special interest in supporting PCOS due to my own journey. So I'm often, you can find me on Instagram at Julia Young Nutrition. So I post lots of hopefully useful information and tips and recipes there. So feel free to give me a follow there. And one of the best things about my job is, when I work with women and couples and then they get their pregnancy and have their baby, and it's really rewarding and it shows the power make people make changes to their diet and lifestyle. So let's start talking a bit about what PCOS is. So it's the most common endocrine, so hormonal and metabolic disorder in women of reproductive age. It affects around 1 in 10 women in the UK, and there are over 276 cases per 100,000 people in Europe diagnosed with PCOS. Now, it's a condition that can be quite slow to diagnose, so it can take over 2 years to get that diagnosis. And around 50% of women are not aware they have PCOS, and the symptoms may go unnoticed until they try and conceive. Also, we know that around 20 to 30 years old is the average age that women may be diagnosed, and 8 to 13% of women worldwide are affected by PCOS. 43% can experience anxiety, 37% may experience depression, and about 70 to 80% of women with PCOS may experience fertility issues. So what exactly is PCOS? Well, as I said, it's a very common endocrine disorder in women that disrupts ovarian function. But I find the name quite confusing because polycystic gives the impression that there's poly meaning many, that you'll have many cysts on the ovaries. But it's not really cysts. It's actually, when looking at the ovaries on an imaging scan, it's actually you have lots of these follicles that tend to get a bit stuck. So you don't tend to regularly get this one dominant follicle that releases an egg and you ovulate. So you have these follicles become stuck. And that's really what it is. And PCOS is a syndrome, meaning it's a collection of symptoms rather than a single disease. So you may well be aware of a lot of the symptoms of PCOS. I've just listed some of them here. Some of them that you may be less aware of, things like there's an increased risk of diabetes with PCOS. It's associated with cholesterol dysregulation, and it's heavily linked with thyroid issues and also endometriosis. So these conditions can overlap as well. And that's why getting a diagnosis can be difficult. There is something called the Rotterdam criteria, which is how it's been going around for a long time, and it's generally how women are diagnosed with PCOS. It's something that's used by the medical profession, and it states that 2 out of the following criteria need to be met in order to diagnose PCOS. The first one of the criteria is having what we call oligo-ovulation, so irregular ovulation, or anovulation, so not ovulating at all. Having symptoms of PCOS, and this includes having blood test results that are related to PCOS, so having some of those symptoms that were on the previous slide, and also blood tests which show high androgen hormones, which are the kind of typical male hormones like testosterone, so those being typically higher in women with PCOS. And then a scan is the third criteria they'd use, so polycystic ovaries appearing on an imaging scan. If you suspect that you have PCOS, it's really important to see your doctor in the first instance. But then there's a question of also, is it PCOS or is it PCO? So you have polycystic ovarian syndrome, which is this collection of symptoms, and then there's also something called polycystic ovaries, and this is really the physical characteristics of ovaries. So again, this is just from looking at a scan, an imaging scan, where they might see lots of these cysts. And that doesn't necessarily mean you have the syndrome, and your hormones may actually be completely normal. So it's different if you were told you have polycystic ovaries. So this is why it makes it quite a difficult condition to actually diagnose. But what's really important is to get to the root cause of why you have this PCOS, rather than just managing these symptoms. So once the root cause or root causes, it can be more than one, are identified, it's easier to address and manage those symptoms. Now, in around 80% of cases, insulin resistance is the root cause, and it doesn't mean you have to be overweight or have difficulties with your weight. There's such thing as something called lean PCOS, where the driver can still be insulin resistance, but you're very slim, or you don't have a weight issue at all. So as I said, around 70 to 80% of women with PCOS will have this insulin resistance. And for those that are not aware of this, it's where the cells in your muscles, in your fat and liver do not respond well to the hormone insulin, and they cannot easily take up glucose from the blood. And now insulin plays a crucial role in the body in regulating blood glucose that moves sugar out of the bloodstream into your cells, and that's really important. We don't want lots of unregulated glucose flying around in the blood. It needs to be going into the cells. So if you have too little, you can feel a bit faint or dizzy, and if there's too much of this blood glucose, it can cause problems to the organs. So we don't want to have prolonged raised insulin levels. And if we have these prolonged raised insulin levels, it can been shown to increase blood pressure, can increase weight and cholesterol levels, for example, and it can worsen your PCOS symptoms. So it's really important to be aware of this common driver. But there are a number of other drivers of PCOS as well. So as I said, insulin resistance PCOS is the most common, and this is where you're having high levels of insulin, which can in turn cause your androgen or your male type hormones to increase. And if you have this insulin resistance PCOS, you may find that you have increased cravings for sugary foods or foods high in carbohydrates. And as I said before, it possibly may mean that you struggle with your weight as well. But as I said, not everyone has insulin resistance with PCOS. There are a number of other drivers as well. So another one is what we call post-pill PCOS, and it kind of does what it says in the tin, really. You may have been taking the contraceptive pill for some time, and your body, you stop taking it, and your body is having then trouble regulating hormones. and you get this surge in androgens, so these kind of male type hormones, is more likely the reason why you have the PCOS. When you're taking the pill, it's often masking what's going on. And ironically, when a woman is initially diagnosed with PCOS, unless you're sort of trying for family at that moment, you may well actually put on the pill to kind of manage your symptoms. The third one is what we call inflammatory PCOS. So this is where there's chronic inflammation and it can drive up those androgen hormones. And this will bring about your PCOS symptoms. So particularly things like acne, so having particularly around the jawline, maybe excess hair growth. And if you're suffering from things like headaches, skin conditions, joint pains, or if you've been diagnosed with autoimmune conditions, then it's more than likely that inflammation is playing a part here. And the fourth one is something what we call adrenal PCOS. And adrenal PCOS is found in women who are under perhaps a great deal of stress, or their bodies are reacting abnormally to stress. And you may have high levels of a hormone called DHEA, which again is an androgen hormone produced by the adrenal glands. And it may actually be that your testosterone is in the normal level, but your DHEA is higher. Your PCOS can also be linked to thyroid issues and gut issues as well. And as I said before, there can be more than one cause that's driving your PCOS, but it's really helpful to know what these drivers are in order to help to manage your symptoms. Now, we can reverse the symptoms of PCOS. We can't take it away completely. We can really manage those symptoms, but we will always be susceptible. So, for example, if you work really hard, if insulin resistance is an issue and you work really hard in managing that through diet and lifestyle, for example, but then you go back to how you were before, your symptoms may well return. So let's talk about how PCOS affects fertility. So women with PCOS may find that it takes them longer to get pregnant. PCOS is characterized by having higher levels of a number of hormones, so elevated luteinizing hormone, LH, and reduced follicle stimulating hormone, FSH, coupled with, as I said before, these elevated androgen hormones and potentially insulin as well. So you may have this limited development of your follicles, which means that egg development can't occur and may result in irregular ovulation. And if you're having irregular periods or longer menstrual cycles, you have a reduced opportunity to get pregnant and actually pinpoint when you're ovulating. And if you're not ovulating at all, then obviously you can't get pregnant at that moment. And so certainly you can't get pregnant naturally if there's no ovulation. Egg quality can also be affected by overexposure to these androgen hormones and high insulin levels. And women with PCOS might find that it takes them longer to get pregnant. But that doesn't mean that you can't get pregnant naturally. So sometimes you may be told you can't get pregnant naturally because you have PCOS. That's certainly not true. That you definitely can get pregnant naturally, but it just may be a little bit more difficult. You may have a bit more work to be done. You also may find that PCOS is often characterized, as I said before, about having these lots of follicles. So if you do a test called an AMH test, or anti-Müllerian hormone test, which again, if you're going to a fertility clinics, one of the first tests they do is called an AMH test. And they do this to get an idea of sort of what your egg reserve is like. With women with PCOS, this often comes back high. It's a hormone, and the levels often come back high because you have lots of these follicles, which can be reassuring because you can think, well, I've got a good egg reserve, but the sort of negative side is often egg quality is affected. So we have to work really hard in improving that egg quality. So if you've been diagnosed with PCOS, you may have been prescribed contraceptive pills to help regulate your menstrual cycle, or maybe you've been told that frustrating thing to lose weight and move more, or maybe you've been told that the only solution is fertility treatment. Now, hearing this can be tough, but the good news is that it is something that you can do about it without rushing to fertility treatment or going on a crash diet. And it doesn't have to be confusing or complicated if you get the guidance and advice and support that you need. So the good news is that, wherever you are on your journey, it's never too late to start with nutrition. And diet and lifestyle changes can be very effective in helping to manage PCOS, helping to improve egg quality and pregnancy success, whether you're trying naturally or going through fertility treatment. So what to do? Well, I'm a nutritionist, so in my opinion, the biggest foundational pillar you need to have in place is food. And everything that makes you up physically, physiologically, mentally, even your thoughts and emotions depend on the food that you eat. However, when it comes to PCOS, fertility, and your health in general, we're all different. So it's not a case of one size fits all approach. So if there's no one diet that works for PCOS, then what diet should we choose? Obviously, there's lots of diets out there. And if you're on Instagram, if you're looking on the internet, you'll hear about the keto diet being amazing, or should you be following low calorie, or maybe it's intermittent fasting, or maybe you actually should be reducing carbohydrates, or maybe you should be eliminating foods like gluten, dairy, or is it better to be plant-based, for example? You may read and hear lots of information. It can be very confusing and overwhelming. And it's a great question. What is the diet that we should be following for PCOS? As I said before, there's no one size fits all approach. What may work for one person or a friend of yours or a colleague may not work for you. But today I'm going to give you some basics to help you get started. But overall, an individual approach is the best solution. I wanted to touch a bit first on weight management. So if you need to lose weight, it's important to know why weight loss or weight management may be difficult for you. So those with PCOS may experience weight gain or difficulty to lose weight due to insulin resistance, as I mentioned before, and due to these increased cravings of sugary and high carbohydrate foods. Also due to this higher level of androgen hormones and potentially a lower metabolism as well. With PCOS, we can have an impaired appetite hormones. So we may have more of our sort of hunger hormone and less of the hormone that we get that tells us we're kind of full up and satiated. There can be some psychological dysfunction. As I said before, PCOS can be associated with depression and anxiety, which can affect our eating choices. There may be some body image disturbance or even disordered eating going on. And all that can obviously have an impact on our weight. But once you get to a healthy weight or you lose weight, there's many benefits, so including improved central adiposity, so that sort of belly fat can be reduced, working on lowering those androgen hormones. We can become more sensitive to insulin, which is great, and more tolerant to the glucose. There's a reduced risk of cardiovascular disease, reduced inflammation on the body, and we can there's an increased spontaneous pregnancy, and we can hope for increased live births as well. So there are many benefits if we work on our health and working to get to the right weight for us. But, weight loss is not easy. There are challenges involved. It's a common struggle for those women with PCOS. Research has shown that almost 60% of those with PCOS are on some sort of a diet, and around 60% of those with PCOS experience binge eating behaviours. It's not easy. And so if you've been trying to lose weight and have struggled, please don't be disheartened, because it's, it can be really tricky. So let's talk about PCOS in the workplace and tailoring nutrition on a busy schedule. So working in a busy environment can make it challenging to prioritize your health, especially when you're managing PCOS. So in this section, I want to explore some practical strategies that you can use with your nutrition, to cope with the demands of work, commuting, and having limited time on your hands. So we'll look at how planning, prepping, and selecting smart food choices can help you maintain balanced energy, hormonal health, throughout the whole day, throughout the working day. And this is starting the day right. And that's with starting the day right with breakfast. The breakfast can be a bit of a controversial one. I'm going to talk about that now. But in my opinion, and from the research, starting the day right means having breakfast. So why breakfast matters. So a nourishing breakfast sets the tone for balanced blood sugar and sustained energy. It can help with weight loss, weight management, hormone stability, and having this, as I say, energy throughout the day. So don't be tempted to skip breakfast, and you really use it as an opportunity to get in fertility nutrients. If we have breakfast, and a good breakfast, it can help us make better choices throughout the day, or maybe less likely to snack throughout the day, which will support weight management and weight loss. So I'm going to talk about what a good PCOS fertility breakfast should include. First, I want to talk about the things we want to particularly avoid. So the types of breakfast we want to avoid with PCOS and supporting fertility is anything that's kind of cereal based, so kind of traditional cereals and milk type breakfast. Something like a piece of toast or a few pieces of toast with something on it, or even just having a quick coffee and missing breakfast altogether. These breakfasts are high in carbohydrates. They can put us on this blood sugar roller coaster. So our energy level is going to be going up and down. It affects things like egg quality. And we could be missing out on key nutrients if we're having those sort of breakfasts. So what we want to be doing is focusing our breakfast around protein, healthy fats, and plenty of fiber. So when I talk about protein, I'm meaning things like eggs, Greek yogurt, nuts and seeds, for example. Healthy fats, things like avocados, nuts, and olive oil. And fiber, when I'm talking fiber, I'm talking about vegetables, whole grains, and seeds. So a few examples of options. Now, this won't be for everyone. If you've got insulin resistance or need to lose weight, this might not be the best option, but something like overnight oats can be really good because you can prep those the night before, put them in the fridge, and either have them before you go to work or maybe store them in a jar or something or a pot and take them to work and have them when you're at work. So here you would combine oats, not a huge portion, a smaller portion if weight is an issue, chia seeds, some type of milk, so plant-based milk or depending what milk suits you, Greek yogurt, go for the full fat, not a Greek style, but full fat Greek yogurt, handful of berries, and then some top up with nuts and seeds and things like that. I said prep the night before, and then you really are ready to go in the morning, so it's really quick. I also like things like a green smoothie. Again, you can prep all the ingredients the night before in the kind of smoothie pot and literally whiz it up in the morning and then go out the door, have it before you go. So something like this, we'd want to put in some leafy greens like spinach or kale or something like that, or any other sort of vegetables, a small portion of berries, a protein source like a Greek yogurt or really good quality protein powder, and maybe a good portion of a nut butter, for example. And then another thing you could do is prepping something maybe ahead when you've got a bit more time, to say maybe at the weekend, making something like individual egg muffins or egg frittatas are really good. You can chop vegetables in there, herbs, things like that, and then simply reheat them and go. I've got on my website, which is www.juliayoungnutrition.com. On the more section, I've got a load of recipes on there, and you'll find some of these on there. So feel free to go on and have a look.
Yeah, sorry to interrupt you, Julia.
Yeah.
So, someone's just asked about the full fat Greek yogurt. I thought it was probably relevant to jump in and ask. Why full fat rather than 0%?
Okay, so firstly, we need fat to help make hormones. It's really important. We shouldn't be, I know we've been taught for years that it's low fat is right, 0% is the right way to go. Firstly, with some 0% products, they'll add in other things in order to get that satisfying taste from full fat. The other point is that it can be quite insulin stimulating, having low fat products, and we don't want to be stimulating the insulin. As I've mentioned before, we want to keep that nice and steady. So actually having fat and protein in your meal that you're having is going to help give you that balanced blood sugar level. So yeah, we shouldn't be scrimping on the fat. That's really important. Not huge portions, but we can look at, then portion size if you need to reduce. But definitely, I normally say go for a 5 or 10% Greek yogurt rather than the 0% ones generally, and make sure there's no added things in there that might be having an impact.
Great, thank you for clarifying.
So as I said, we keep these things that you're prepping beforehand in the fridge. and it will just save you time in the morning. I know for a lot of people, you know, they may not even have time to do that, and they're really late, or they just don't have the facilities. If you're needing to go and get breakfast while you're out and about at work, think about where you're going. Best place to avoid are those coffee shops. It's quite often all they have is pastries and things like that, which again is going to put you on that blood sugar roller coaster. Somewhere like Pret a Manger is quite good. They do like egg and spinach pots. They do salads and things like that. They do yogurt pots, but be careful because quite often they're laid really high in sugar. So again, you need to be a bit detective and look at those labels. But generally Pret has a few good options. I really like Leon. If you have a Leon where you are, they do lots of egg-based breakfast. M&S do salads and things like that. And it doesn't have to be a traditional breakfast thing either. There's absolutely no harm of having, either having a salad or something like that for your breakfast, or if you make extra and take leftovers in, or have leftovers from the night before. There's no reason it has to be this traditional sort of cereal and toast type breakfast that we've all been taught is the way breakfast should be. The main thing I said with PCOS is we don't want to leave it too long before we have that breakfast. We really want to be eating something about an hour after waking, because that helps to reduce our cortisol level, which is our stress hormone. So for women with PCOS and when you're trying to conceive, we don't want to be doing fasting and having these long gaps, really long gaps without food. So we want to, within the first hour, we want to be, having some sort of breakfast. That was, everything on breakfast. So I want to move on to lunch and think about how we can make our lunch options PCOS and fertility friendly. So lunch is a really good opportunity to get infertility nutrients. Use your lunch break to refuel with balanced meals that stabilize blood sugar and support. So some meal ideas would be, so going for a sort of balanced salad, some mixed leafy greens with a lean protein, something like grilled chicken or turkey, or if you're plant-based, tofu or tempeh, with some legumes like chickpeas and lentils, things like that. Real variety of colourful vegetables, maybe some nuts and seeds in there, and some really good quality extra virgin olive oil would be a really good lunch option. Whole grain wraps can be nice as well. For a more portable option, make sure you've got your protein source. Again, maybe some chicken or some plant-based protein. You could have hummus in there, opportunity to put in lots of veggies and make yourself a really good satisfying wrap. Buddha bowls are nice as well. So again, you could have some small amount of whole grains, some fresh vegetables, your protein, and then your olive oils and some lemon juice in there, for example. And again, if you can prep these in advance, prep it night before in the morning and take it with you, that is going to always be the healthier and more economical option to do it that way. Again, if you're out and about and you've got no time to do lunch, try to opt for salads. Fresh soups, if you can get from a supermarket, are quite good as well. You might have a facility at work where you could heat up a soup or take it in a flask with you. Just to be warned that quite a lot of those fresh soups aren't that high in protein, so you might need to add some additional protein just to up the protein source there. But always look for sort of high protein options and plenty of veg for your lunch. What you want to be kind of avoiding are those meal deals. May seem like financially a good option. Often they're like a sandwich, packet of crisps and a drink. Very low in nutrients, high in carbohydrates. Their sandwiches would be very different to something you make at home, because quite often it's just 2 pieces of bread with a little tiny bit of protein in the middle, probably not much salad or veg there. And they're quite often heavily processed. So better to go for something, if you can, that you make yourself, or something you can pick up, like a salad or something from a supermarket. So I put it here in this slide. So your wraps, your salads, and if you can, prep beforehand. And then talking about snacking. So I generally say avoid snacking if possible. So snacking can lead to weight gain or difficulty losing weight. And actually having nice long gaps in between our meals, not too long, but at least going 3, 4, 5 hours in between our meals, not eating, is actually really good for the body, the digestive system, to be able to rest and repair itself, and actually a chance to us to burn fat if we need to. So actually this constant snacking, which again has become very popular, and we're always told about snacks and things like that, it's not necessarily the best option. However, if you're having really long gaps, or maybe you've got a meeting and you're not going to be able to eat, it's going to be a really long time, then snacking can be a useful strategy to help keep your energy levels up, and curb you cravings later on, or you then after that meeting kind of eating way too much. So yeah, some snack ideas. So I would say having a bag of mixed nuts or seeds in your handbag, or just so in your desk drawer handy, always good, because you can always snack on those if need be, and you know what you're getting with those. Having some fresh fruit or pre-cut vegetable sticks, or maybe some with a dips of hummus, something like that. Having a yogurt available with some, maybe again with some seeds, or you can maybe make something at home at the weekend, some energy balls or something like that, and take those in. Again, those will be infinitely better than kind of the snack bars protein bars that you can buy from the market. Best snacks that you can have are the savoury type snacks. Again, we want to be reducing that sugar intake. And also ask yourself, I get a lot of this with my clients, that when I say to them, you know, when you're snacking, are you actually hungry? Are you just bored? Quite often, more than that, often not, they're actually bored, and it's habits. So do check in with yourself first and think, you know, has it been 4 or 5 hours since I've last eaten? Is my stomach genuinely rumbling and it's not also thirsty? Could be thirsty. Sorry, you could be dehydrated. Have a nice glass of water and see if that fills you up a bit. And then if you can say, no, I am genuinely hungry and it's been a long time, then yes, have a snack. But you know, do check in and see if it's actually could well be boredom or a habit. So yeah, again, if possible, prepare those snacks the night before. You know, even if you can take a cooler bag with you or something, or in your bag, just have, you know, in your car if you're traveling, have those snack options to hand. Right, so I'm just going to touch now on what to avoid to support PCOS. I don't want to go too much into detail about this, and I do have a free guide that covers this in more detail, along with foods we want to be adding in, which I'll talk about at the end. But it's important to touch on foods that are not helpful for PCOS and can exacerbate our symptoms. The first one, again, you've probably heard this before, but sugar or refined carbohydrates. Now, it's not just about the obvious sources of sugar, like your biscuits, cakes, chocolate, etc., sweets, but also what we call refined carbohydrates. And I like to describe these as a kind of white, fluffy carbohydrates. So thinking things like crisps, white rice, white bread, white pasta, pastries. Those are your refined carbohydrates. And these foods can cause your insulin levels to rise sharply and stimulate your body to produce more testosterone and disrupt ovulation, and can lead to weight gain. So we really want to reduce those foods. We talked about the fat. So low-fat dairy can stimulate insulin production, and you know, some low-fat dairy products can have often contain added sugar to make up for that reduction in fat. If you did a comparison and had a small bowl of kind of very low-fat yogurt and then a higher fat yogurt, you'd notice how much more creamy and satisfying that higher fat yogurt is. So it does fill you up. It does have that action. And you know, as I said before, fat's really important. We make our hormones from fat, so it's really important we do have some fat in our diet as well. Artificial sweeteners, they can still impact our blood glucose levels when they're consumed, and therefore can contribute to insulin resistance. Research has shown that they can have a negative impact on our gut health and our gut microbiome. And there's also been some recent research linking certain sweeteners with cancer, increased cancer risk. They tend to be heavily processed. I do know people, if they're trying to get off sugar, they might transition to artificial sweeteners. You know, that's okay if it's just a temporary thing, but I say try not to rely on them. And actually the best thing you can do is get used to a more savoury taste, rather than just moving on to a different type of sweetness. Alcohol, I'm sure you've heard, does not support fertility, and unfortunately doesn't help PCOS symptoms either. Studies have shown that even moderate alcohol consumption negatively affects fertility in women. It increases miscarriage risk and increases the time for pregnancy to be achieved. And alcohol is also high in sugar, which can make PCOS symptoms worse. It's high in calories, so again, can lead to weight gain. And then caffeine's a bit of a one I get asked a lot. Caffeine consumption has been linked to increased risk of miscarriage and reduced fetal growth in pregnancy. It does stimulate our adrenal glands to produce stress hormones and increase blood glucose levels. So I'm not saying we should be having no caffeine at all, but maybe reduce intake if you're having a lot of caffeine. I also suggest that people eat something before, if they're having coffee, for example, in the morning. It's always better to not have it on an empty stomach, which again can increase our stress hormones, our cortisol. Better to have your breakfast first, wait a bit of time so we can absorb those nutrients, and then have your coffee, rather than the other way around. So, and I want now to talk about a few of the lifestyle issues with PCOS. So, stress is a big one. Why stress matters. High stress levels can impact hormonal balance and worsen PCOS symptoms. We know that stress harms both male and female fertility significantly. And we know that the stress of infertility or going through fertility in itself is stressful. There's some research that actually shows that when rats are stressed, they actually end up with shrunken testicles and ovaries. So even animal studies have shown the impact of stress. And it can affect ovulation in women and testosterone levels in men. And it's not just the obvious stresses of, infertility or work stress. Stress on the body can be things like infection, malnutrition, anxiety, or depression. So we may not even feel stress, but there can be stresses going on in the body. But the good news is that there's most interventions for stress improve fertility success rates. And you can see some of them listed here. So things like deep breathing can be really helpful. And you can do this at your desk without anyone knowing. You can do it for short bursts throughout the day. It can be really helpful for bringing our cortisol levels down. If possible, taking mini breaks, so taking brief walks or stretches at your desk to help clear your mind, and using mindfulness apps like the Headspace app, the Calm app, for guided mindfulness sessions during breaks or when you're commuting, on the train, things like that can again be really helpful. So we want to incorporate small, regular stress relief activities into your work routine. Even a 5-minute pause can make a difference. Stress is unavoidable. So what we need to do is try to work on our reaction to stress. So a few other lifestyle factors and PCOS. So I want to look at lifestyle strategies in a busy work environment. So beyond food, things like sleep, really important, movement and hydration are essential for managing PCOS. So hydration really important for supporting the transport of our nutrients and the absorption of our nutrients. There's no point, eating all this good food if we're not absorbing it. Being well hydrated can help increase our cervical mucus, which is important for ovulation, increase energy levels, things like that. So keep a water bottle at your desk, and even if necessary, set reminders to make sure that you're drinking regularly. Sleep is probably the next pillar after food that I would say is important when it comes to fertility, but PCOS for sure. Sleep's really important. So we need to prioritize good sleep hygiene by winding down before bed, maintaining a constant sleep schedule. So quite often people you might be getting up early during the week and maybe having an earlier bedtime during the week, but then at the weekend you might stay up late and watch Netflix and have a lie-in. Research actually shows it's better to try and maintain a consistent sleep schedule, so it's the same bedtime and get up times during the week and weekend. That tends to be the best thing for our sleep quality and our hormones and that sort of thing. Movement's really important, so scheduling brief bouts of movements, so that could be a brisk walk during lunchtime or a quick desk exercise. Walking is actually really good for bringing down our blood glucose levels. So if you do have the luxury of having a lunch break and you get the chance to have a walk, and there's an option of sort of eating your lunch first, then going for a walk, or walk first and then lunch, try and do the eating first and then the walk. Because if you can have 10, or even 20 minutes of walk or movement after you've eaten, it will help bring those blood glucose levels down. And then just boundaries are really important. So setting clear boundaries between work and personal time to help manage your stress levels is really important. Okay, so I want to just then touch on overcoming common workplace challenges. So there's the social and environmental pressures of work. So social eating. So learning strategies for handling office treats and group lunches without feeling deprived. So quite often I know from when I used to work in an office, there would always be treats or cakes around the place. We used to have people would go on holiday and bring back local chocolates and things like that. And where my desk was always happened to be next to where everyone put treats. You can't always move desks, but what I did in the end was just move the treats somewhere else, put them in the kitchen or someone else's desk where they're happy to have them. Because if you can't see them, when they're right in the corner of your eye, it's just so tempting to keep going for them. If they're not near your vicinity, you can't see them, you're less likely to go for the treats. So just get them moved out of sight, out of mind. Group lunches can be tricky. If you know where you're going for the lunch, have a look at the menu in advance, plan what you could have. If it's maybe everyone's ordering in sandwiches and you're sitting in a conference room and having a group lunch that way, can you bring your own lunch, or can you just bring your own healthier addition to that lunch? So could you bring in some chopped vegetables or stuff like that? So you're just improving on what you're having. When options are scarce in the workplace cafeteria or during business trips, plan ahead. If you can bring your own PCOS friendly meals or snacks, obviously meals is a bit more difficult, but maybe snacks, making sure you're having nuts and seeds and all those healthier snacks we talked about. Some of my clients would take a bag of good quality protein powder and maybe add that to hotel breakfast that they're having to make sure they're getting plenty of protein, although hotel breakfast is normally quite good because there's always like egg-based options there, but maybe taking a protein powder and having a shake if needs be. And communicate your dietary needs confidently if needs be. A simple explanation of your health goals can encourage understanding and support. So you don't have to tell people that you're on a trying to conceive journey. You can tell them you're on a health kick or something like that, and that's why you're not having the cake, the birthday cake or whatever. You don't have to tell them everything, but sometimes if you give them a bit of information, you might get less pressure, and it might be that little bit easier. So actionable tips with this is pre-pack your meals and snacks, identify healthy choices available nearby or at your workplace, and have a list of alternatives that you can go to maybe traditional lunch options. So really planning ahead, basically. So coming to the end, so I wanted to just do a bit of a recap and give you some key takeaways. So we started off talking about understanding PCOS and how it impacts fertility and overall health. And then the focus was very much about nutrition at work. So I hope I gave you some practical strategies for your breakfast, your lunches, and snacking that support hormone balance and help to support your PCOS symptoms and your fertility. And then we also talked about stress management and lifestyle. So giving you simple yet effective ways to integrate stress reduction and healthy habits into your busy day. So I want to just leave you with this sort of final thought that small, consistent changes in your daily routine can have a really profound impact on managing PCOS and boosting fertility, even amidst the demands of a busy work life. So you don't have to, I don't want you to go away feeling overwhelmed with this. Just take away a few key things that you think, I could do that. You can do that consistently. That's going to have the biggest impact than rather than trying to change everything and then changing nothing, basically. So just, one or two things can really get you to the best result. So as a kind of thank you for joining me today, I've got a free download, which is called From PCOS to Pregnancy, Root Cause Strategies to Transform Fertility Naturally. So there's some simple strategies, some recipes in there that I hope you'll find useful to help support PCOS and fertility. You can scan that code there on the screen to get your free copy, or I know that Jude will be sending out the link as well. So thank you for joining me. I hope you feel empowered with new ideas to support your PCOS journey at work. Remember, it's about progress and not perfection, so every positive change counts. Do visit my website, juliayoungnutrition.com, for meal plans and tips there. And if you need any personalised guidance, I do offer one-to-one support. I offer a free 30-minute fertility review where I can talk about how you can work with me, that sort of thing. And I've got some new developments coming soon for PCOS and fertility, so have a look on my Instagram or on my website. That will be coming soon.
Brilliant. Thank you so much, Julia. That was just such a wonderful, comprehensive, yeah, informative session. You just covered so much in such a short space of time, so thank you. And I think as well as it being really helpful, obviously for PCOS, there was just loads of really good tips in there and takeaway things that you can do if you're generally on a fertility journey without PCOS, I think. So thank you so much. It was brilliant. There's a couple of questions I was going to ask before stopping the recording that are sort of more general, and then we'll stop the recording. And if anybody wants to stay on and ask a couple of questions, then we've time. So the first one was someone asked that if you do get pregnant with PCOS, is your pregnancy classed as high risk because of the syndrome?
So it really depends. That's a difficult one for me to answer, really. It depends kind of firstly how you got pregnant. So was it through fertility treatment? Was it naturally? I've had clients that have got pregnant naturally through PCOS and they've been absolutely fine and needed no more than the regular support you get from the NHS. So it depends, is weight an issue? If you're overweight or obese, for example, then you're more high risk anyway. So it's a little bit difficult for me to answer, but many women there's a slightly higher risk, there can be a higher risk of miscarriage, for example. But many women go on to have an absolutely normal pregnancy and live birth and no problem at all. So obviously go for your regular checks, and if any blood tests or anything comes back abnormal, then you will be regularly monitored anyway. But for most people, for many people, it's absolutely fine. It just kind of depends on individual circumstances, really.
Brilliant. Thank you. And then I was going to bring up the idea of snacks because I was thinking you'd said about avoiding long gaps between meals, but actually you then touched on it. So you've covered everything I was going to ask, but it's brilliant that you had some suggestions about snacks as well as meals. Because I think that's sometimes the hardest thing in the workplace, isn't it? That you need to often jump into a meeting before you've got a chance to have your lunch, and therefore what can you do to have a snack that's healthy up your sleeve? But thank you, you covered it. The only other thing I was going to ask is about supplements. What would your advice be about supplements as well as obviously food?
So with supplements, it's a little bit tricky because supplements do need to be personalised to the individual. So because what works for one person doesn't necessarily work for another. So I always say work with someone that can advise supplements one-to-one on that. And I do offer supplement reviews, so people can work with me on that. But generally, and also the thing I often get is people come to me and they're taking a whole host of supplements because they've done their research and they've read a book that said this is good, that is good for PCOS, etc. So they kind of take everything. And it's really important to remember a couple of things. Firstly, your body has to process every supplement you take, and that includes your liver. We don't want our liver to be working harder than it should be. So actually, sometimes less is better. We don't want to be taking loads of different supplements. And also the quality really varies of supplements. So if you're buying your supplements from a supermarket versus maybe getting it from a certain good quality dispensary, you may be maybe cheaper from the supermarket, but you may be getting a lot less nutrients in that way. And often the cheaper ones have fillers in them and added things that you don't necessarily want to be taking. So good quality supplements is really important. But things to consider are inositol or myo-inositol. Again, you may have heard of this, which is a compound that helps to improve insulin resistance, lower testosterone levels, and can help support blood sugar levels. So it can be very helpful for women on PCOS taking a form of inositol. B vitamins can be really important, especially B12 and folate, to support energy production and help to regulate hormones. And often vitamin D is important. It can often be low in women with PCOS, so it's important for immune and hormonal balance. But also vitamin D, get your level tested. You can do this quite easily through your GP or just a cheap online test to test your vitamin D before to know exactly how much you need. But vitamin D can often be important. Magnesium, great for sort of supporting any stress or anxiety, support relaxation, can help with sleep and improving insulin sensitivity. And omega-3 fatty acids, so really help reduce inflammation in the body, especially if you've got this sort of inflammatory PCOS, and help to support hormonal balance. So they're just some of the ones I might think about, as well as a good quality fertility multivitamin as well. But I always suggest getting advice from something.
Brilliant. Thank you so much.